Good morning, Dr. Lebowitz, Long Island Gynecomastia Center. So I get people, as you know, from all over the world. I get a lot of people from LA. I mean, there's great doctors in LA, but they come to me because of my social media presence and my results. And really, I go far and above anybody in the world in my gynecomastia surgery. A lot of doctors just focus on the nipple and just make you flat. I go beyond it. Because I trained with the great Alfredo Hoyos in Bogota, Colombia, who specializes, and I do also, total body high definition 4-dimensional LipoSculpture. So I took that and concentrated that on the gynecomastia surgery. So not only do I do the chest where the nipple is, but I etch, define, reveal, and contour the pectoralis major muscle, the lats, the serratus anterior muscles, and the six-pack. And I'm going to start doing only, if I do lipo, everything down to the belly button, because I tried to do shy of the belly button. But you know something, if I'm going to do it, like Mercedes-Benz says, it's all or nothing. So I'm going to really start to do it. And I got these long cannulas. I can even go down even further now to really define. So when you start to look and research gynecomastia doctors, I'm a quantum leap above everybody else because I spend my time and effort and technology and technique in making you look great. Not just the chest, but really the entire torso as much as I can. And I'm one of the only ones in the world that does local anesthesia. So let's turn our attention to this young man. He's from Los Angeles. He's got a boyish body. He's first of all, his posture is not too good, which we all are. It's my back and my neck, everything hurts. So if you look at him, look at his shoulders. His shoulders are down and forward. His shoulders should be up and back. Stomach should have a constant, like someone's got to punch him in the belly. So posture is very, very important. Genetically, this is the way he is. He does go to the gym. He's got some great muscle in there. He's got some great shape, but he needs to define it better. So he's got little gynecomastia, but that's not all he's here for. This is the gynecomastia. I can take care of this. But with me, it's everything, as I said. It's squaring off this pectoralis major muscle. I talked to him about putting fat in the muscle itself to give him more bulk there, but a lot of my patients don't want that. Define the lats back here, give him a great negative space between the lateral pec and the lats itself. Do the serratus anterior muscle here. I'll define that, give him a little contour, and of course my six-pack. Now I'm going to not make him look too aggressively six-pack. It would look weird on him, but a little hint of a six-pack I think would be awesome. Get that midline there, get the linea alba right here, and define the six-pack. Stealth incisions in the armpit, by the nipple, and inside the belly button. Drains, yeah, because I've been using drains more. I take him out. He's staying for 48 hours. I'm going to take him out before he flies back to California, so he doesn't have to worry about those. But it just drains it, the J plasma gas, and any fluid that'll come up. I find it's a nice thing. Glands, he doesn't have much gland there, but we will explore underneath the glands itself to make sure that that's out completely. Because when you do lipo and you do gynecomastia surgery, you need to explore underneath the nipple and take out the glands. That's a mandatory thing. So with me, it's everything. Every muscle counts, definition counts. I want him to look great, feel great. So when he enjoys his, California weather, he's happy and thrilled. And go to the gym, of course. You can't just eat ice cream and burritos every day. You need to go to the gym and eat healthy, build muscle and exercise, and do everything right. So I want to mark him, numb him, and let's go to the OR. So here I'm framing him like a frame of a picture, the extent of where I'm going to go. But I want to go even below this. I want to go, sorry, but I want to go down here and stuff more. But this is kind of the framing down here. So we got the pectoralis muscle here. And here, don't want to go too far up north, so I want to maintain volume here. That's important. Kind of see where the six-pack on him is right here. They're a little bit off center. There's something going on here. So what we are, he's comfortable here. He's under local anesthesia. You can see the markings. The markings are amazing. We're gonna get such great, and it's better to be in the, people ask me, should I lose weight first before getting this? I mean, of course. Be in the best shape possible before the operation. Don't say to me, oh, I just want the gland out, I'll lose weight after. I don't trust anybody except me. So if I say to you, you need lipo, don't say to me, oh, just do the gland, I'll lose weight later. It doesn't happen. If I tell you need lipo, you're gonna need lipo and gland removal. If you just need gland removal, that means you're in fit shape, you don't have excess body fat. This guy is not fat at all, but he needs more shape, and lipo is the better option for him. So bring on down here. So I'm gonna grab kind of underneath the nipple, get into an area that I've already numbed. All right, so here, I'm in here. It looks scary, but it's not. Here we are. He's numb. We let it sit for a few minutes and go nice and slowly. Vaser is meant to be delicate and nice, not like regular liposuction where it's, barbaric and you go through hard tissues. So the Vaser is a prelude just before the liposuction. It melts the fat. In this instance with gyno, it melts the gland, and it allows easy, beautiful sculpting by lipo. Come down to the lats back here. Get this here. Get under this gland. Again, if I bombard this gland and the chest and really sculpt this nicely, get that great negative space right here. That's where down to the serratus muscles. Getting down into the side. I'm at the nipple and I'm etching this negative space between the lats here, down here, that's the lats, etching that little space, and the pec muscle here into the armpit. All right, here we go. This is J plasma again, helium gas with a radio frequency spark. This is the last part of my operation before I close the wounds. This, in essence, tightens up the skin. Unlike anything before that's possible, except of course to remove skin, which we don't want to do because that leaves scarring that we don't want to give. So here we go into the stealth incisions and get in there. Here we go. And give it, and that's the gas flowing up. Make a muscle strong. Yeah, you look at that volume there. Scrunch your belly, show me that six-pack. There you go, that's the six-pack. That is amazing. Space, perfect, serratus, rectus, lats, pecs. Beautiful. Dr. Lebowitz, this is what you get with me. Extended gynecomastia surgery, body contouring surgery. You come to me, you get the best, and you get the results that are amazing. Glands were really not that big, nothing too impressive, but you got to explore underneath there and get the glands out. And fat-wise, we got almost 3 liters, just shy of 3 liters of fat coming from him, and he's not a big guy. So gynecomastia, me, Lebowitz, 631-424-0101, or of course email me at jonathanlebowitzmd@gmail.com. LA to New York, results which are amazing.